Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
It's December 6, 2021,
Hey.
and this is the Auburn Medical Group live stream where we are going to be talking today, Dr. Gwen and myself, about remote patient monitoring. RPM is what it's called in the medical world, and we have actually some examples of blood pressure RPM right here in the studio
That's exciting.
to show you and to talk to you about it. So anybody who has high blood pressure might be especially interested in this, although really only if you have Medicare will it apply directly to you at this time anyway. And also in the future, well, not even in the future, right now, RPM can also apply to people that have lung conditions, you know, where you have to have an oximeter at home.
Yeah,
People
monitor.
with congestive heart failure, where
Weight.
you would have a scale at home. They can also have it for diabetes, for checking your blood sugar. So these are all things that can be measured electronically with a numerical value sent digitally to your doctor. And in fact, it's being done in regular doctor's offices right now. We're doing it. That's what Holly, our director, does normally day to day, is she's monitoring people's blood pressure remotely.
Right.
Just regular old patients who have Medicare and getting it paid for by Medicare.
And actually getting better blood pressures.
That's the
That's
important
probably
thing.
the more important thing,
Yeah,
right?
yeah. So how has your week been, Dr. Gwen?
It was good. I had a busy weekend.
Yeah, I saw you during part of it.
Yeah,
We had our office party, and it was great. I think. Do you think anybody was surprised that there was no alcohol at the office party? Some of the new employees, maybe.
maybe, I don't know.
They may not have known that that's the way we roll.
Yeah,
so
that's how we roll. It was still fun.
yeah,
You could have a party without alcohol and have fun.
I'm glad you had fun. We played Exploding Kittens. It's a card game.
Yeah, no kittens were hurt.
Just want to make sure people understand it's the name of a card game.
That's right. We played this game where we...
So, do we have comments or questions from the folks on the live stream? Those of you who don't usually watch us and are wondering what's going on, we are communicating real time live with our audience through live stream chat on YouTube, which you can be a part of if you subscribe to the channel and click the bell icon on the YouTube page to set it up for notifications to come to your device when we go live, which is almost always 4:30 on Monday afternoons Pacific time. So what
Yeah,
kind
we
of,
don't have Ed, or Mr. Ed, so
yeah, we don't have Mr. Ed reading
He's
it.
probably
so
out Santaing or something.
he might be Santa Claus right now. Oh, look at that. I see that something from Lindsay. Hi, Lindsay. And she's, can you read what, I have to lean way
She says,
forward. I probably get
"Hi."
off focus.
Now, Lindsay says, I'm at work,
I
but
can
I made it. Don't let your boss
Probably
know.
supposed to pay attention to work.
Good thing this is a
Which I
safe
think-
for work.
I think that's in a mortuary.
Not NSFW.
And NSFW, not safe for work. Okay, I get it. It is for me.
There
It
is, I think, an NSFW
It's safe for your work.
Exploding Kittens version, maybe.
I guess so. So I'm sorry, I couldn't read. Either Holly or Dr. Gwen, was there any comments there, or is it just people greeting us like Lindsay Antwine before we jump into the topic here? Of
No, it is
RPM?
more than just
Oh,
that.
Gee,
Laura,
super chat, Laura Barzik. Look at that.
this is fascinating. I've never heard of remote monitoring. You are in
goodness.
luck. We got to talk about it today.
And she gave super chat so we can have Dutch Brothers today. Thank you, Laura.
And then we never have it.
Are
we going to be checking my blood pressure?
We all thank you. Yes.
Oh, no.
Okay, maybe that's not good timing having the Dutch Brothers before we
Everybody's
check our
going to
blood pressure.
see the
because
doctor's blood pressure go up in real time.
Caffeine does cause elevation of blood pressure. Okay, so should we get started with a demonstration, or should I talk a little bit more about what RPM is?
Well, let's talk more about what it is.
Well, okay, so we'll show you some of the units that we have on display here right now. Right here in the studio, we have the ForaCare, which is really interesting. It has this little slot here for sticking in a glucose stick, a test strip. So it can also send in electronically your glucose readings to your doctor. And then this one's called is it the BT105 or it probably says on the back. It's the BT105.
Look at that.
Body Trace 105. And a couple different companies use this model. And then this one over here, I don't even know what to call it. It's
Isn't it the Cardio Cellular?
Well, Cardio is one of the companies that uses it. And let's see, I think HealthMote uses both of these, right? HealthMote uses both of these. HealthMote's version of this is called Pylo, Pylo, and it's the exact same unit. It's just blue instead of green. Nothing to do with pyelonephritis. No, it doesn't cause pyelonephritis.
Every time I see that, I'm like, when I say pylo, here's what I mean.
It's short for pyelonephritis. Yes, pyelonephritis, right?
Pyelo. Yeah, there's an E in there.
Okay, no, this is just Pylo, Pylo. So these are 3 different units that are used to remotely monitor people's blood pressure. Now, 2 of them are amazing because...
Which one? We're going to mix them up.
Look under this one. No, it's gone. These are these 2 here, the Body Trace and the one that, the Pylo Cardio unit. Not to be confused with the Cardio Arm, which some of you may be familiar with, that works with cell phones through Bluetooth. These 2 work through cellular service. They have a SIM card built into them, and they send their readings through cell phone networks to the doctor's office. They get it through a dashboard that they can log into securely so that they can monitor your blood pressure from the office. So you take your blood pressure daily, and your doctor's office knows whether your blood pressure is high or not. And so in our office, it's Holly with an H who monitors it. And so all of our patients know who do this know Holly's voice when she calls, because that's part of the program is once a month we have to make telephone contact with the patient confirming, yes, you are a real person and you're alive and we are talking to you. Medicare requires that to pay us for it. The other part of it is looking at the blood pressures and adjusting their blood pressure medicine if it's ever necessary. And every month there are people whose blood pressure is uncontrolled, which is the weirdest thing.
Yeah.
It's okay. So,
but there are a lot that are controlled.
Let's take a step back to way blood pressure used to be managed in the old days before RPM. So you would come into your doctor, and 2 years ago, or actually in many offices right now.
Still today, yeah.
Are patients who don't have Medicare right now.
That's right. Yeah.
They're not benefiting from this because it's not covered by their insurance.
Yeah.
So Medicare is paying for it. We do it for Medicare patients. The old way of doing it is you would go to your doctor's office, you'd get your blood pressure checked, and it'd be high. So we say, okay, let's start some lifestyle changes and see if we can get it come down. And so then you do some monitoring on your own, maybe with your own unit or at a drugstore or a friend's blood pressure cuff. And then you come in, and if it's still high after doing the lifestyle changes, and we need to protect you from the risk of heart attack and stroke, we give you medicine to help reduce that risk. And then you go home and try the medicine for a while and come back in and see how the blood pressure. And generally we would do this, I tend to do it on monthly intervals. I don't know about...
Depends on the numbers.
Depends on the numbers. So monthly intervals, because we're trying to get the blood pressure controlled. The quicker, the better. So this could take, for many of our patients, they go through 3 doses of one medicine and their blood pressure is better, but it's not controlled. And then we go through up to 3 doses of another medicine, different strengths, that we add on top of the first one. So 2 medicine blood pressure. And that's a common thing in our practice, and probably in a lot of practice, that people have blood pressure that hard to treat. I don't know if it's as true outside of America, but... a combination of weight and diet,
universal in America at least,
and not really good activity. Those people who are taking care of themselves and are active and are eating healthy, it's less of a problem with them. But high blood pressure is still a fairly common thing, and along with it comes risk for heart attack and stroke. So we address those things. So you can see that this is taking months and months and months of adjustment and then rechecking. Well, if we have somebody on this program, we're seeing what their blood pressure is daily, not monthly, daily. We're seeing what's happening in response to adjustments in medicines. Not that we change a medicine based on daily readings. We get 5 to 7 days of readings, and with that much time, you have a pretty good idea of what the effect of your change in the medicine is going to be for the patient. And this has really accelerated controlling patients' blood pressure. We even did a study of our own patients, retrospective, which we always tell you is not the ideal, but it's the data we had available.
It's what we had.
And we found that we got a 19-point reduction in systolic blood pressure using this technique compared to a control group of similar patients that we didn't start it with, who, I hate to say it, but under standard treatment here, their blood pressure went up a little.
They were so great.
It's not that it didn't go down as much.
Actually, the other way.
So, huge difference in results. 20-point difference. That's, according to the studies that we look at, that's a reduction in half of somebody's risk of having a heart attack or stroke.
Yeah. Okay.
Is it time?
I guess so. Are we doing dueling blood pressures?
Yeah. Are there any comments we need to...
I actually had one. Lindsay say, people irritate me all the time. Monitoring my blood pressure would be like watching a roller coaster. Well, we're not going to slap it on you when you're irritated. Actually, to get a good blood pressure, and we coach our patients on this.
You shouldn't do it during a live YouTube live stream.
You're supposed to be sitting in a calm place, feet on the ground, back supported.
I'm the only one dressing on camera.
Because I came prepared. Look at that. I just roll up my sleeve. Show these
How do you do that? I thought you had guns.
Thought? Which one do you use? Which one should I use? This one?
I don't know. Holly says this one's loud. And this one we actually don't use. The one that also has a glucometer in it and only works through
That's so loud.
Bluetooth. So I'm not going to use this one today, even though I
get it the rest of the way. Okay, good.
Went to the trouble of charging it up.
All right, let's see. Through that way. Let's find our...
Are we doing it at the same time?
Yeah, we should.
They have an indicator somewhere.
Where is the...
Perhaps it says index.
Is it right there? Is that it?
Okay, there.
It says okay.
Did you notice that you never heard Velcro opening and closing on mine? Mine was pre-sized. Maybe I just don't have as big of muscles as Dr. Gawain, who can very easily raise up his shirt above the muscle. I just want to point that out.
Oh, there we go. Index.
All right. So my feet are flat on the floor.
Okay.
My arm is not at the level of my heart. I'm not sure what I'm going to do about that.
Support it with my other arm.
With your other arm? Can you be relaxed while doing that?
Not really. I'll just do it.
Okay.
Do I press a button here?
Yeah. Are you catching this?
There it goes.
Oops, my hand's on the frame.
Your hand's
Oh, I'm not talking. Mine just says error. My batteries are dead? That's what error 1 means? I feel like I've been sabotaged. Okay, I can talk because my blood pressure is not being checked. And Dr. Gawain's blood pressure is being checked. Oh, look at that. He is our model patient.
128/71.
Okay, can I have your batteries?
That's after.
No, I'm going to use your machine.
A cup of this.
Can I plug this in? No. Let me just use your machine.
Here, use this one. Oh, there you go.
All right. So here we go.
Move on to that one. Let me restore my arm here.
Restore your arm.
All right, your turn. It's the number to beat.
That's the number to beat. Kind of like when we were playing Dig Dug this weekend.
Oh man, you blew me out of the water in Dig Dug.
I did. Well, I have it at my house, so that's why.
You get to practice.
I do it every day.
Every day.
All right.
That's the first thing my boys talked about when I got home. Was there Dig Dug there?
There we go.
Did you play Pac-Man? Actually, it was a work party. Lindsay said Dr. Mark taking his shirt off and Dr. G rolling up his sleeves are about to raise some blood pressures. See how I did that? At the perfect time. I don't remember what my pulse was. I guess we'll see.
Oh, no.
Whoa.
No.
Oh my goodness, what's going on?
Not as good. So that's a heart rate of 55. That's cool, but 139 over...
What was my heart rate?
Oh my goodness, 91? I thought it said 81. Oh, that's not cool.
Whew. Stage 1.
Okay, so we need to follow up on that. Maybe it had something to do with...
Real time, we are getting a diagnosis.
It's good to learn from other people's mistakes.
Don't drink a cup of coffee. Don't drink a cup of coffee before you do your blood pressure.
Learn from my mistake. Okay, so, you learn things when you monitor people's blood pressure. right. So
That was on the same machine too. So
I wish my insurance covered RPM so that
I could send you home with that.
you think you can send me home with the demo one. So that shows you what it is, and we don't have to do anything else. It's just that one button, the start-stop button on at least on the cardio unit and the pilot units.
Sent to
Well, and the body trace too.
sent to the
Yeah, it's being sent
as we
on the
talk.
demo account.
On the demo account as we speak.
I think we'll reset it when we give it to a patient.
Yeah, probably.
That's what RPM is. You've seen it. You understand. If you have any questions, please type them in now or put them on the comments of this video if you watch it after the fact. RPM, this is using electronic technology. It's digital data that's being sent. And we happen to be scheduled to attend the Consumer Electronics Show the first week of January. We'll be making videos of products like these, and we will have different titles. So like the titles of these shows, it says AMG Live after the title. Right. It'll say CES RPM if it has to do with these types of products, RPM products. We'll also have another one that says CES Medical for medical products, and I think we'll also have some for CES, and it may just
Crazy
say CES.
antics. Oh, I mean what? Crazy antics.
Crazy antics. It may say consumer or not anything, and it won't even be related to...
Last time we went to a show together,
I think
somebody
Lindsay
ended up on
an
escalator spinning.
Anybody who watches my
somewhere.
personal YouTube channel, which I just call it Dr. Vaughn, YouTube/Dr. Vaughn, you'll see that video of me wearing a cowboy hat, spinning on an escalator after I had a lot of caffeine.
In San Antonio.
In San Antonio.
Yeah.
That was at a different conference. That was an EMR conference, not not CES. So any comments or questions from you? We'll go to
I don't think we have anything,
the live stream to see what you have going there.
Hopefully that was exciting.
Hopefully that was
my blood pressure.
Well, Lindsay said something about that being
that's what it's
a treat. Okay.
But Laura says this would be great to have. My blood pressure was high at my last cardiologist visit, and he went straight to have me get an ultrasound of my kidneys.
Yeah. Sometimes we'll do that with
sure.
really high readings that aren't responding well to medicine. We need to see if there's something like what we call renal artery stenosis, where the artery to the kidneys is tight, and the body's trying to get blood flow to the kidneys, and so it does weird things like increase blood pressure to the whole rest of the body. All right, thank you. Did you have anything else you wanted to add, Dr. Gawain? Now, we will not ignore what is going on in the world, especially medically. Right now, Dr. Gawain addresses it in Dr. Green Knight for today, which you can find at drgreenknight.com. I'm sorry, I don't have a link in the description just yet. And you can also find other things on our socials by using either the Dr. Vaughn or Dr. Green Knight tags. We're on Twitter, and I'm also on Instagram and Facebook, but you don't do much there for the medical stuff.
No.
So we'll give you a little quick summary on the COVID Omicron situation. I'm now pronouncing it Omicron instead of Omicron since I found out it comes after mu in the Greek alphabet. And does it come before pi? I don't remember. But it looks like an O. So Omicron, I will call it. This has already been addressed. We talked to KCRA Channel 3 here locally about it, and there'll be a link to that in the Auburn Medical Group press page. And also put out information on the Dr. Vaughn's COVID-19 Updates podcast that as of now, Omicron, the latest information I've seen, Omicron looks to possibly be, and I use the term cautious optimism, hashtag cautious optimism.
That's a hashtag now?
Yeah. Hashtag cautious optimism. KCRA used it.
Oh, okay. All right.
For their story title, since I used that terminology. Cautious optimism about the Omicron variant, that it could be. Now, I'll give you the absolute most positive scenario, and that's that it saves us from the pandemic.
Yeah.
That would be the ultimate best outcome it could have. And I'm actually very, very hopeful for it. Chances are it won't be perfect and it won't be as great as I'm hoping for, but it could still be positive in that it makes death less common. that it is more easily spread and therefore becomes a predominant variant in place of Delta in our area, many parts of the world, and therefore less people will be dying, and it'll be less of a threat. And hopefully our people with vaccines are less likely to get it. Certainly they'll have less severe disease. That's what's expected anyway.
Yep.
Anything to add to that?
No, that sounds about right. But got more updates. Yeah. A lot of it is yet to be seen.
Yeah, this is early.
There are nuances here and there, but I do address everything that is known over at drgreenknight.com.
Yeah, we will know more in the coming weeks, and
like
everything
a week or
I've
two,
said
we'll
here
really know where we're at. We'll probably
could be replaced. We may be saying the exact opposite a week from now, but for now, to see that I've yet to see a reported death from it this far into it, I'm super encouraged by that.
Yeah, very good.
Very encouraged by that. So, anything else on our?
I think so.
Okay. Anybody you want to thank?
Yeah, over at DutchGreenKnight.com. I am on Patreon. Check it out. But yeah, I would like to thank Teresia Rowatt.
Yes,
she is a Patreon.
Teresa.
Thank you for what you do.
And also thank you to Lindsay Antwine and for what she does. And there are other people too that we thank, and you'll see them over in this part of the screen when we play our outro. You can also get your name there by clicking on the link to Patreon, which will be somewhere in this area very shortly. Till next time.
Oh, hey, I'm Dr. Graham Vaughn.
And Dr. Mark Vaughn, telling all of you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.